Welcome, everyone. Go ahead and get settled. The meeting will begin in about a couple minutes.
Liz, isn't this when we do the elevator music?
Yeah, I've been advocating for a Zoom version of soft elevator music
Yeah.
so that the first 5 minutes of every meeting can be somewhat less awkward.
Well, careful there. We might lose people when we start playing that elevator music.
That's true.
All right, looks like most people are getting their audio connected. So I can start with my little housekeeping intro and then pass things over. So good evening, everyone, and welcome to tonight's live virtual program. I'm Amber from the Adult Services Department here at the library. Thank you for joining us this evening. I have a few housekeeping items to share before we start the presentation. Tonight's program is scheduled to run until 8 p.m. During the program, all attendees will be muted, so report any technical issues you may have in the chat. During the presentation, I'll be monitoring the chat messages and they'll only be visible to hosts. There'll be a Q&A session after the presentation, so feel free throughout the presentation to put your questions in the chat, but we'll wait till the end of the session to go over the chat and the Q&A. There are subtitles enabled for this program. If you want to turn them off, you can. Should be a hide captions button. It should say CC at the bottom bar, so that'll hide the subtitles for you. Tonight's program is also being recorded and it'll be available to watch on the library's YouTube channel soon after the video ends. Without further ado, I'll turn things over to Ellen Lafferty.
Thank you so much, Amber. Good evening, everyone, and thank you for joining us tonight. And it's great to be back in 2023 presenting to the Livingston County public, and partnering with the Howell Carnegie Library and presenting these informational forums to the Livingston County public. For those who are new to our public forums, the League of Women Voters of Livingston County is proud to be a nonpartisan, nonprofit organization. We neither support nor oppose any candidates or political parties at any level of government, but are always working on vital issues of concern to our members and to the Livingston County public. You can always follow what we're up to, what's ongoing work of our league by going to our website. You can just search League of Women Voters of Livingston County and we'll pop up. And the same with Facebook. We're on there as well. I want to take a quick moment to thank the Howell Carnegie Library and especially Amber Carnahan for making this virtual program available for everyone this evening. If there's any questions from our guests this evening, please ask them through the chat function or wait till the end of the presentation when all questions will be answered. We want you to put your question into chat, but we'll address it at the end. We don't want to distract anybody from the information that's coming out. Our guest this evening will be bringing you a conversation on the conditions of working families known as ALICE households, asset limited, income constrained, employed, here in Livingston County. You're going to learn about the numerous local agencies that are helping to support those affected and ways that you can get involved in their work. I'd like to introduce you to Rennie and Liz Welch from Livingston County United Way and Amber Johnston, Livingston County Community Collaborative Planner. Thank you so much for being our guest tonight. I'll turn it over to you.
Thank you, Ellen. We appreciate it. So I'm Ann Rennie. I'm the Executive Director at Livingston County United Way. A little bit of my background, is that I've worked at United Way for a little over 3 years. Started right before COVID, so you can imagine it's like learning by fire. But before that, I worked as the Community Collaborative Planner, which is what Amy's job is now. She replaced my position. And then before that, I had worked in Brighton area schools for 10 years as a community ed director. So I have been a community organizer in our county for quite a while. And it is because I'm passionate about our community that these kind of conversations are so important. I get the opportunity to talk a little bit about poverty. So, a lot of times people hear, poverty numbers or poverty statistics, and they wonder, what does that really mean? Well, the federal poverty level in this county, in any county, is one person makes $13,590 a year. So about $6.53 an hour if they were to work full time. And as you know, minimum wage is, high nines, I think it's like $9.80 an hour. And in this county, shoot, you can get a job at McDonald's for like $16 an hour. But as soon as you make that kind of money, $9.87 an hour is going to put you over the threshold for one person for the federal poverty guidelines. And the reason that's important is that the poverty guidelines is how the government determines if you're eligible for what we call social supports. So if somebody is in need of financial supports at a federal level, they use the federal poverty levels. And a lot of our agencies use those statistics in order to serve our population. So if you get a state grant, say you're working for like housing or food, they may say you can serve somebody who might be 150% of the poverty level, but it still is not a lot of money in order to qualify. So a lot of families, are just a little bit above that, but they're not making ends meet. In our county, people always say, well, really, what does that look like here? What does poverty look like? Well, it looks like people with disabilities. It looks like older adults who might be on fixed incomes, people who have like mental disabilities. If you have a diagnosed disability or you're an older adult getting Social Security, you're probably falling into that more poverty level. Your income is at a level where it would be very challenging to afford rent on your own as one person. So that's why oftentimes people say, oh, we don't see people here from poverty. Well, you do. You're just not realizing what fixed incomes really look like. And then again, once you're at that level, so say you're at a level where you are in getting some sort of social supports, it's very challenging to pull yourself out of that and get back on your feet and start, making a wage to get an apartment here. And so really it's a never ending cycle at that poverty level. So why does United Way value serving people in poverty or the ALICE population? Is because our goal is to get our community on their feet, is to find ways to help people to bring themselves up and be able to stabilize in our community. You may not know that the original Livingston County United Way was the community chest on the Monopoly board. It was a chest in the middle of a town, and people who had means were allowed to put money into the chest, and people who needed some could take money out of that. That is pretty much the concept that Livingston County United Way still does these days here. We gather donations, and then we get them back out into the community through local agencies who serve the populations that need them, for whatever reason that might be. One of the great things about the United Way funding is that it allows flexibility. And I always like to quote Mark Robinson, if you've ever met him. He's the executive director over at Catholic Charities. And he always says, United Way funds let me do what I need to do to serve somebody. So if somebody comes to him that has had a crisis or like a health issue or something major, and they're not really qualifying for like a federal guideline, but they're just having an issue that they need some help with, our funds can fill that gap. They can help him to be able to serve them without all the criteria that goes along with that. So for us, that's important because, as you know, all of us could have an episode, all of us could have a car repair or something that knocks us off our feet for a little bit. And so United Way's job is to try and make sure we fill those gaps and reduce those barriers. Now I'd like to introduce Liz Welch and have her give a chance to share a little bit more about the ALICE population.
Hi there, my name's Liz Welch. I work for Livingston County United Way as the Community Investments Director, and I'm a lifelong Livingston County resident, minus the time I went away to college and got my degree. And few years to determine that I needed to come back here, but I've worked in the nonprofit sector in this county for 20 years at a variety of organizations. And in my current role, one of my projects is to share out ALICE data. So I'm going to go ahead and share my screen if I can here. And I would love to take you into the ALICE presentation. Can you guys see that screen? Okay, fantastic. So first of all, I just want to tell you a little bit about the ALICE project. The ALICE project is a grassroots movement committed to strengthening communities by improving the lives of ALICE. So as mentioned, ALICE is an acronym and it stands for Asset Limited Income Constrained Employed. A crass way we used to say that was the working poor, but we say ALICE, and so I want to make sure you know what that concept means. ALICE is our families, neighbors, colleagues, people who are working hard. They earn above the federal poverty level, but not enough to afford basic household budgets of housing, childcare, food, transportation, and healthcare. The federal poverty line, as Ann mentioned, has been the standard measurement for poverty throughout the country. And this measure determines the qualification for many social support programs. But the methodology doesn't take into account cost of living. And cost of living is particularly relevant in Livingston County, and we're going to really take a deep dive into that. So I just want to mention before we get started that the 2021 report is based on 2019 data. So it is pre-COVID data. And we are looking to get post-COVID, more fresh data, actually coming up in the month of April or May. So hopefully soon we can give you an update and let you know a more accurate detail of the landscape. Okay, so ALICE, what's the issue? First of all, a little bit of foundational information. In Michigan, there were over 1 million ALICE households in 2019. So 25% of the state's population fell into the ALICE demographic, and 13% fell below the poverty line. So together, that's 38% of Michiganders that were struggling to meet all their basic needs even before COVID, and are likely having great difficulty reaching self-sufficiency and building towards a brighter future. So for our Livingston County, obviously we are a very affluent county. So we tend to have a relatively stable percentage of the population that is below the federal poverty level. So we had 5% at the time this data was captured, and then there are 19% that were ALICE. So that's a total of 24% of the population that was at or below the ALICE threshold. So when I talk about ALICE, I'm talking about both those in poverty and the folks that we call ALICE. So just want to keep that in your mind as we go along. So I just feel like it's worth noting, and I wanted to pull up this slide, that in all the ups and downs of the economy, the poverty level in Livingston County has only swung between about 4.8% and 7.4%, no matter what, like the market was doing. Things could be like terrible or really great, and our poverty level stays relatively stable. Folks at the poverty level may actually not notice the ups and downs of the market, but both ALICE and those in poverty can be impacted by factors such as inflation or shrinkflation. So going on, I just wanted to kind of lay the landscape there because the ALICE population is probably going to be more significantly impacted by rises and falls in the market. Folks who are living very close to, like hand to mouth, if you will, in poverty, they're really used to what it takes to survive a day and what resources are out there. ALICE folks may encounter problems for the first time and need to reach out, having no idea who's there to help. So that statistic I mentioned before, that's 17,554 households total in this county. That's 1 in 4 Livingston County households. So that's a significant number of people. If you're standing in line with 4 people, one of them is not able to meet all their basic needs all the time. And for an affluent county, that's pretty surprising and maybe even a little sad. So now I want to take a deep dive into some data with you. So don't get too distracted by the numbers just yet. I want to kind of frame it up. If you visit the ALICE Research Center, which is an actual online platform, and I will actually share out with the slides how you can go there and do a little of your own digging, you can pull up a survival budget that was created using real world cost of living. So the ALICE household survival budget is the bare minimum cost of household basics that are necessary to live and work. And these include housing, childcare, food, transportation, technology, and healthcare, plus taxes and a contingency fund of about 10% of the household budget for like those unforeseen things that do come up. So this budget is calculated separately for each county. Excuse me. and for different household types. And it's updated as the costs and household needs change over time to give you an actual picture of survival. And I did say survival because these survival budgets don't include luxuries, enrichment classes, school sports, annual vacations, leisure spending. They don't include investments in higher education, saving for emergencies, or for retirement. This is a survival budget. And so this snapshot I'm sharing right here, I just selected a demographic to kind of show you, because every household's budget is not the same. So this is a single adult, a single senior, and a family of 4. So kind of take a peek there. That's the bare minimum for those different demographics to live. And I particularly chose a family with 2 adults and 2 children. If those children are in daycare, if they're in higher ed, if they're older and eat more, that's going to do things to the budget. So what's great for you is if you go to the Alice Center, you can actually plug in a real demographic of people you're working with or trying to do outreach for, or even your own family, to get a feel for what is a survival budget in this county. So I benchmarked the federal poverty level here for those same demographics, so you can just have a look at like the disparity between what it is going to take to just live and how low you could be, where you'd be getting some social supports. So at poverty level, or within a percentage above that level, families could reach out and get some help from the government or get some help from various programs for the things that they need. So I just actually want to take a minute and look at a couple of those social support programs. So if you have a child who's not yet old enough for kindergarten that needs educational support and you wanted to put them into the Head Start program, you have to be within 100% of the federal poverty level to qualify. So that's a free program, and you would qualify if you were within 100% of the federal poverty level. An Alice family of 4 must make less than $26,500 annually to qualify for Head Start. So if you make more than that, Head Start's not going to be accessible to you. SNAP. Okay, so if you qualify for SNAP, which is Supplemental Nutritional Assistance Program, some people call this food stamps or food assistance or EBT. It helps families get groceries. You have to be 130% or below the federal poverty level. So as your income level rises above 130%, you're no longer going to be able to get SNAP. So that family of 4 that I'm using as my example has to make less than $34,450 annual to qualify for help getting food. Now, that's not to say there aren't other programs out there to get food. We'll talk more about that later, but you would not be able to take advantage of SNAP. Healthy Michigan is a healthcare coverage program for individuals who are like 19 to 64 who don't qualify for Medicare. So if a family of 4 made more than $35,245, they're not eligible for this program because it goes off of 133% of poverty level. Now, I just picked these 3 programs to kind of cover a span of some programs you're probably aware of. But all of these utilize a percentage of federal poverty level as the qualifier. And it's not to say that the individuals might not qualify for other programs or community-based resources. But you get the idea now that if you work harder and increase your income, as you know, that's the American dream, right? You work hard, you get ahead. But actually working harder and increasing the income actually works against a family until they reach the earning threshold that equates self-sufficiency. And that is based on the cost of living in the county you live. So many times I would hear somebody saying, why can't I get ahead? Because you don't make enough for the cost of living in the community where you live is the reason, 9 times out of 10. All right, so you're working your family budget, you're being careful, along comes an unexpected crisis. We've all experienced unexpected crises. They appear for everyone. It could come in the form of an emergency dental bill or an emergency car repair or a major rise in the cost of regularly purchased groceries like we experienced in the last year, or a massive increase in gas prices. And thank goodness that's calmed down a bit. But for Alice families who are already living in a tight, balanced budget, these crises can become the last straw. So I want to now really take you into a deep dive into survival budgets that I really think highlight sort of the impossibility of being low income in this county, and how the high cost of living presents working families super hard hurdles to sustain their family households here. So this is a Livingston County survival budget for a family of 4. And I picked it based off my own family demographic. So it's an easy one for me to get my mind around. You can see all the line items here included and what that family can afford to spend in each budget category. You can also see at the bottom below the line, I've just made it easy for you to look at what the family has to make from all sources of income by the hour, per month, and annually. And when you're looking at survival budgets, I just want to say first off that it does not matter how the money comes in. There can be all kinds of breadwinning scenarios in any given household. There could be one breadwinner who has a good job and someone else stays home to care for the children. There could be multiple breadwinners. Even some of the children could be working. It doesn't matter how the funds come in. It could be through a hodgepodge of part-time jobs. But that's how much they have to make total, and they have to work full-time. And the next thing I want to do is I want to look at some areas that are particularly sticky in people's budgets, and that also are important areas in Livingston County that we've recognized as being significant and areas we could improve. And I'm basing this actually off of a recent community health needs assessment that was conducted by St. Joseph's Mercy Healthcare System. It was done in 2022, and they identified that access to healthcare, behavioral health, mental health, food security, and transportation were the 4 top concerns for Livingston County for the next few years. And we're also expecting to see similar work published soon by the Livingston County Health Department, but they got busy with a little public health crisis, so their normal cadence was delayed. Now I'm going to get back into budgets a bit. So here we go. It's the same monthly survival budget for that family of 4, but I want to focus on healthcare and talk about what's embroiled in there. Access to healthcare and behavioral health were number 1 and number 2 in the community health needs assessment. But in our survival budget, they're rolled together, and a family of 4 allows $569 to be spent. This includes all health insurance premiums, all out-of-pocket costs like co-pays, prescriptions, medical supplies, behavioral health expenditures, including counseling and therapy, assessments, and medications. Now, this is an average budget, so if 1 or more of people in the house have health vulnerabilities, people require frequent care, costly equipment that's not covered by insurance, or medications with a high copay or that aren't covered by insurance, that can plunge the household pretty quickly into the negative. Now, I said food was number 3 on the community health needs assessment. So let's just look at this family's family of 4 budget for $955 a month in food. Now, when I assembled this report, I found myself thinking, well, that's quite a lot of money to spend a month on food. And I thought, wow, that's generous. But those numbers are actually based on the USDA My Plate Thrifty budget, which is the lowest of 4 suggested meal plans for how to eat healthy and shop in stores. And so the high cost actually has more to do with purchasing the needed groceries locally. And I can tell you at the time I made this, I thought it was generous. Now I can just share that my own family of 4 spends over $1,200 a month on our food budget when being cautious. And an important thing to mention in the food line item, I think that operating on a My Plate Thrifty budget assumes some things about a household's functionality. It assumes that all the members have the time and skill to create meals from scratch, implement meal planning, and find time to carefully shop and cook. Packaged and pre-processed goods cost a lot in the stores. The thrifty budget does rely on consumption of a high number of starches, and it might not be feasible for families who have people who are diabetic or folks with food allergies or intolerances. The thrifty budget also does not allow for much waste, so you're going to be eating some leftovers, and you can't let your bananas go brown on the counter because anything you're throwing out is something that you're not able to eat. And really forget about dining in fast food, especially right now, right? Because you've all probably experienced the cost of that going really through the roof. So this is a pretty tight budget for a family of 4 for food. It's a lot of scratch cooking, and hopefully someone has a time, mental, emotional capacity to do that. Let's talk about transportation now, which was the 4th concern on the community health needs assessment. What's included in the transportation line item, which this is a big piece of the budget. Gas, oil, vehicle maintenance, insurance, license and fees, public transportation, if that's viable. For a survival budget, this particular family of 4 only has 1 car. If the family requires 2 cars for the logistics of meeting employment and school schedules, they're now going to spend significantly more than their budget allows if they have car payments and just the regular upkeep and gas. It's all rolled into this line item. So we've looked at some numbers and budgets, but really, who is Alice? Let's consider the people behind these statistics. Alice is the earning level of a home health care worker, a daycare worker who looks after children so we can go to work and feel safe. Alice fixes our cars, works in our grocery stores, serves dinner at our favorite restaurants. Alice is many of the people that we called essential workers during the COVID crisis, and we really recognize that without them, our world can screech to a halt. But let's look back at this budget one more time, because I want to talk about something. According to the Michigan Alice report, 70% of infrastructure jobs paid less than $20 an hour in 2019. And 63% of those in the nurturing fields, healthcare, education, caregiving, made less than $20 an hour. So those super important jobs, not really compensated commensurately. If Livingston County residents were working and they had a family of 4 and their one family member goes away to work and is at the top end of that pay scale for nurturers, they are making $20 an hour. Could they make it in this county as the sole breadwinner of their family? Let's have a look. No. And I actually want to show you side by side. They're going to actually come up about 20 grand short to make a survival budget at $20 an hour if they're the only one working a full-time job and nothing more in their household. So you would need to make an additional $19,448 to sustain a basic survival budget. So being paid $20 an hour, which, to me off the top of my mind sounds great, that's not enough to live here and raise a family. And remember, again, going back to the idea that this is a survival budget. This isn't building to stability with savings. This isn't a future focus. This is just enough money to get by. And if I had super unlimited time, I would love to share the recent benchmarking study that the Ann Arbor Spark organization just completed, because it really sheds some light on wage stagnation in this county and, like employability, and just really shows you some things about cost of living. And it relates Livingston County to other like-sized and demographic. So when we share the slides, I would love to give that resource to you if you want to check that out. It's really telling, and it just supports what we already know. It's tough to get by in this county, particularly those with entry-level jobs or doing caring. When dollars run out, Alice families are forced to make really difficult short-term choices that can result in long-term consequences. Things like paying the heating bill instead of rent, or deciding to purchase essential meds instead of putting a really healthy dinner on the table. Really quickly before I talk with Amy, I'd love to show you just a couple of slides that kind of talk back to the landscape of poverty in the county. I just find them pretty interesting. So this is more current information. This was taken from a census map. This is kind of showing you where is poverty concentrated in the county. And so the darker blue on the map, the more it's a concentration of poverty. So you can see, like, right in our county seat, north and south of Grand River, right in Howell, there's poverty on both sides of the road. The northeast corner of our county has quite a bit of concentrated poverty. And then the southwest corner as well. I'm sorry, the southeast corner as well. I feel like that's just interesting information to understand where the people are living kind of in demographically, they're concentrated together. This is the landscape of poverty in families whose mothers with children under a year are in the home. So again, that northeast corner and the county seat are high in poverty with children living with their mother. This is poverty among families in Livingston County. So any size family. This is kids living in poverty is really what this demographic is showing you. And then lastly, I find this fascinating because the darker blue on the map, the more people are concentrated in poverty. But on this map, the darker blue, the more people are accessing food stamps. And I think that this is interesting because I just think it sort of contradicts the notion that some people have that people in poverty might be overutilizing services. Because there's really only in that northeast corner and right in the county seat are there are even significant number of people who are utilizing food stamps. And I think stigma and insufficient or ineffective outreach are parts of that. And there's probably lots of other factors. But I just think since you guys were interested in knowing what the landscape of poverty, I just thought I'd throw those in here. So kind of now what, I sort of feel like this information is a little on the bleak side. And with possible recession looming in the new year, I think it looks like it could get even more bleak. But here with some hope and some actionable ideas is my friend and colleague, Amy Johnston. She's the Community Collaborative Planner for the Human Services Collaborative Body. And I am going to turn it over to her, but I'll keep the slides up for you, Amy.
Thanks so much, Liz, for setting me up to bring the hope. So I'm Amy Johnston, like I said, Community Collaborative Planner for the Human Services Collaborative Body. I have the joy of working with Ann and Liz on many, many things. So I'm grateful to be here with them to be the hope pitch hitter. I don't know, sports analogy. So I am also a Livingston County resident for my entire life. High school, went to high school in Fowlerville, master's in social work. I do in macro social work, and I love my job. I love what I do because I get to work with really great, amazing people. I don't know if there's a way to ask this question and say, has anybody here on this ever heard of the Human Services Collaborative Body? Like, thumbs up. What? I don't. Nobody's on, so you can't wave at me. But I'm gonna guess probably not many of you have heard of the Human Services Collaborative Body. And this is a tiny slide. I'm going to populate the chat with a bunch of links at the end so you can follow up on some of this. But the Human Service Collaborative Body, we have a great mission, ensuring a system of support for all members of our community. And the work that we do to work on the support system is through work groups at the county level. So you can't see really well, but in the middle, I'm going to see if I can annotate this box here. Can you see that? And Liz, you see my like drawing on here? Those are kind of the work groups, the main work groups. So you can see foster, adoptive, and kinship care, mental health, homeless continuum of care, transportation coalition, hunger council, substance abuse, treatment and prevention, abilities alliance, funding partners, and we have a few sister coalitions up on the left, which is the Leadership Council on Aging and Great Start Livingston. We also have a hoarding task force. So you can see many work groups, and I sit on all of these work groups, and all of the work groups bring together the agencies in the community that work on these issues and work on the gaps and what are the needs and plans. And it's pretty exciting to see that. So I really wanted to highlight that there is this whole system of support group. This is actually Anne left this on the wall of the office. And so I get the pleasure every day of looking over and just seeing the scope of work that is done at this county level. So it's pretty exciting. One of the work groups, our community needs assessment work group, which is up towards the top, they work on fact sheets. And so I really want to talk about the different things that that you can do to make a difference in our community for our ALS families. And so some of the work groups, we put out an annual report. I'll actually give you the link to the annual report. It's hot off the press, just printed. It'll go out to the annual meeting in 1 month. Don't tell anybody that I'm sharing it with you early. But it's really exciting. You can see all of the work groups outcomes from the past year. And then the link will have all of the other annual reports. But then these fact sheets, what's great about them is we, a lot of the work groups put together a fact sheet and they talk about what is the problem. Let's just say hunger. That's easy. Everybody can understand what that looks like. What's the problem? Hunger. What's the problem and what does that data look like in Livingston County? So all the fact sheets are kind of set up in the same platform, the same format. So the problem, what does it look like in Livingston County? And then who's working on this problem? What's being done about it? What programs or services exist? And then what can you do to get involved? And so these fact sheets are a really great resource and they're updated every other year. And so also with COVID, there's some data lags for all of our data sets. So we trying our best to kind of work around that. So I'll put some links. I'll put a link to the page with all of the worksheet or fact sheets so you can see them. But they're hunger, housing and homelessness, financial. Then the annual report I'll put in there too. So the HSCB works really hard to put together resources. We have a resource list. We have a resource guide that shows you what to do if you need help for the first time. So like Liz says, these ALS families are just on the edge, right? One crisis away from needing help for the first time. And what do you do when you need help for the first time? Where do you go? It's not an easy answer always. And sometimes we get the runaround, right? And shuffled around. So we try to put together this kind of step-by-step resource guide that also was just finished, I want to say the beginning of December. So that just went out as well. So I'll share that as well. Next slide, Liz. And I don't know if I will clear the drawing. All right. So what can you do to help our ALS families? So there's three things, obviously: donate, volunteer, and advocate. What I want to say about donations, and I have to promise you that Liz and Ann do not pay me to say this, okay? I don't work for them. I get no money from anything that they do at all. But I can tell you, with the work groups that I do, 2 of their 3 funded coalitions, so the United Way funds 3 coalitions, 2 of the coalitions I work directly with. So I can see this impact. And I need to tell you, the Homeless Continuum of Care is the highest funded coalition. They receive $315,000 from United Way for 1 year services. So that's 9 agencies, 14 programs that make up this Homeless Continuum of Care. Because what do we know about homelessness? It's complicated, it's complex, and we need things from prevention, treatment, and then, support systems to move back into housing. So we need help along this, and to bring affordable housing. So we need all of these services on the spectrum. So I want you to think about this. With $315,000, we could barely purchase 1 home in Livingston County and house 1 family. So 14 programs receive these funds, and then they go out and they do their work. Imagine the ripples from this money, this one easy donation to United Way on Matching Money Monday, I'm just going to say, and then the outcome of getting money into these agencies who are on the street doing the work and taking care of our families. It's totally amazing. So that stone throw in the water, there's that ripple, that one ripple, and all of the support that comes from that donation is really, really an easy thing to do to help our families. Also volunteer. There's just so many words to say about how great it is for you, and to get out there and make a difference. And then you can see what it means to be part of the solution. You can pick your favorite agency, or you can go down to volunteerlivingston.org, and you can search by your interests. Like, this is a fantastic database. So the agencies put in what needs they have, and you can find something to do any day, night, weekends, all over the place. So that is a great opportunity. And advocate. I think by you being here today, you clearly care about the issue, and that even understanding what we're talking about and understanding the services that are out there. So advocating for your client, helping them understand where they can get emergency food boxes today. That makes a huge difference, right? Because when someone's in a crisis, you're not going to think clearly. You need somebody to help navigate that system. So knowing where to find the resources, knowing what agency to call, reaching out, helping the agencies, advocate out further into our community, and to help, even helping the United Way raise money. They're going to be doing it again for our coalitions. So anything we can do. You can join work groups. You can just learn and understand our needs and find other ways to support us. Okay. Next slide. All right. So I'm really excited. You guys have heard a lot of information that's a little bit heavy and a little bit depressing, and even more now, I think, with, like, if one more person tells me the cost of eggs, I'm going to probably scream. So we know it's bad, right? We know it's bad. But I hope that you can have a better understanding of what this looks like in our community. We know that homelessness and need looks different. And like Ann said, and my job is actually housed at Community Mental Health. So I completely agree with this. Our ALIS families here in Livingston County are really those with significant needs, their mobility needs, their mental health needs, their disability. There's other things going on with our families that are really difficult to overcome. And I can tell you, as the sandwich generation with 2 parents who need care, and a teenager and a 10-year-old, and all of the things, it's a lot of work. And so I understand how it can be one crisis away from needing help. And then where do you go to get that help? So I really hope that you've learned more about our community, and that we've inspired you to take some action and to make some changes for the community at large. That's my presentation.
So if you guys want to take the reins and see if the audience has any questions, I will just scoop up the tail by saying that we do have the PowerPoint presentation is available, and all the links that we share in the chat, as well as all the links that were. I encourage people to do a deep dive into the data and check out the sources that we found this information on your own, because I think you'll find things that even we didn't have time to present, but also, if you really understand the data yourself, you're going to be a great advocate and person that can educate others. That's an important part of why we're talking to you tonight, so you can spread the word.
And I agree, those fact sheets that Amy has, they are, when you look at the Livingston County data, it's pretty staggering. It really dives into what we see here. So take a minute to check those out. I think they're very telling.
I just wanted to share with everybody that we're going to be following up whoever registered tonight. Your follow-up email will list all of those links and include all those, the agency links and the fact data sheets and such. So please don't panic that you have to write down everything really quick. Also, we're going to share, hopefully, this recording is going to be on our YouTube channel as well as the library's YouTube channel. So you can not only watch it again and kind of incubate with those facts a little bit more, but also to share that with others who might benefit from them. And so I'm going to ask Amber, do you have any questions that have arisen?
I haven't
Otherwise,
seen
we'll
any
open it up
yet.
to everybody.
Yeah, there's no questions yet. So if anyone has questions, feel free to put them in the chat and we can get to them. I can also allow people to unmute if you like raise your hand, then you could ask a question out loud if you'd like.
I wanted to ask Amy, for one, you have something going on, and Anne and Liz, on February 4th, is it? You have a community collaborative event. You want to talk about that a little bit? Does that link in and help folks, or we can send folks to it if they need any additional support in the services that are being offered there?
So are you talking about Community Connect or Livingston Link Up? The 4th?
I think it's the 4th, the Saturday.
Yes, so Community Connect, it's the 16th annual Community Connect. It's at 242 Community Church from 10 to 1. And this is an event for anyone that has needs in the community that they're interested in coming out and learning about the services in the community. There are giveaways. We actually have some services on site. We'll be doing haircuts. They have a hearing screening. The health department and Trinity and U of M Flint students are out doing health screenings. And then we have, oh my goodness.
Legal advice.
Oh yeah, legal advice. We have 60 plus exhibitors on the field, and then a whole bunch of giveaways for all the guests, including blankets and care packet, like personal care packages and food.
Laundry detergent.
Laundry detergent. I did get a question, I think directly to me, but do you want me to ask that now?
Go right ahead.
I think it was to United Way. How does United Way obtain your budget?
How do we obtain a budget?
Your budget? Their budget? How does United Way obtain their budget?
So how do we generate the donations that we fund into the community? Is that my understanding? Okay.
And I put the question out there.
Hey,
So
Claire.
yeah, so my question is I do realize that a lot of it is by donation, but are you matched by your donations? And is it several drives? How do you go about raising your budget so we would know what to look for and when to look for it?
Sure. So United Way, this United Way has a variety of campaigns that we do. So we do a traditional employee campaign. So United Way from the beginning has done employee campaigns where employers commit to inviting their employees to donate through payroll deduction. And that still occurs with many of our larger organizations in the county. And some of our small folks do as well. So we still do that kind of fundraising. And then oftentimes the business will do also a gift, a corporate gift. And then outside of that, we do some grant writing to try and get funds to support that really comes into United Way and then might go out to support like hunger council. So it kind of, again, the goal is to get it into the hands of the agencies that are directly serving the community. And then we also do a number of fundraisers. We just had the Matching Money Monday fundraiser in December. That is our one big fundraiser a year. I'm gonna cough, sorry. Sorry. And they, that is matched. So dollar for dollar, we have sponsors who match every dollar that comes in on that event. And they match it up to the amount that we have in sponsorship. So there's a number of different ways that we raise funds. But really, the great thing about United Way is that by working with Amy and Liz being on those work groups, it really is to address the highest needs. Like when they come with a presentation from Hunger Council, they're saying, we need this, this, and this. And that's exactly, we want to know what the community is needing. And we want to serve in that way and get it back into the hands of those agencies that are on the front line. Did that answer it, Claire? I'm sorry.
Yes, thank you.
And there's, I think, a follow-up question. Are county tax dollars being used to help Alice residents, or is it all volunteer donations?
So we don't receive what county is in county, like commissioners and county grants. No, we don't receive those kind of funds. We have worked diligently the past year to get some ARPA funds, which is the American Recovery Plan Act funds that went into our counties and our townships and our cities. And we just heard right before the holidays that they're going to possibly help us to create a coalition for older adults. So taking the Council on Aging, an existing coalition, and making that same funding mechanism where they work together on a solution across the county. So that will be the first time that we've gotten what we would call county funds, but we're excited about it. It'll be great.
Yeah, but in general, we do not get county funds at all.
Nope, not normally.
There's another question. How do these organizations work with St. Vincent de Paul and other private organizations?
That's you guys.
St. Vincent de Paul is, so they are a fantastic partner. And what's great about faith-based or grassroots agencies is that they don't have to follow specific funding guidelines. They answer to their own organization and they come alongside us. They are fantastic partners with all of the work we do. They're a great partner for the homeless continuum of care for sure. We rely on them tremendously. But what's great is they don't have to follow Michigan State Housing Development Authority rules about housing and fair market rent and all of the like barriers, red tape, I don't know, whatever we want to call them. Their guidelines or HUD guidelines, they can help in a very different way. So kind of those gaps, the same way that United Way funding sort of allows a gap fill for these agencies that are following other programs. Does that answer your questions? Our faith-based, they're tremendous partners in all of our work. I also have another question directly to me. I've heard some people say that Livingston County has an abundance of charities that serve the needs of the poor in our county, and that other areas such as Detroit or Flint would need my donations or efforts more.
So I don't know. I can only speak to that. I have a philosophy about community. I don't get me wrong. I have my own. I donate to things that are related to my family's like illnesses or supports that they receive for like cancer and things like that. But I also have always donated to United Way in the community and where I live, because I feel like there's a level of responsibility to kind of pull up your neighbors. And if my neighbor next door said, I'm having car problems, can you, help me? I would drop everything to help. So for me, yes, there's always going to be a higher level of poverty in a city area, like a large, dense city area. But I think there's something to be said for making a difference with your neighbors or the kids. Like when I talk to my kids and they were in school, the kid next to them that doesn't have a lunch, there's something to be said about making a difference for that kid's family that sits next to your kid at school. And now you're providing a lunch. I mean, there's just something that I feel makes a difference right where you live. You can always give to larger cities, but they also have access to larger state and federal grants and just, natural resources that come through because they're a larger city. So You know, people tell me all the time, they're like, well, I already donate to this and this. Of course, United Way should be your second favorite donation place. Your first one should be something, you know, whether it's your college that you love and made a difference in your life, or like I said, a cancer association, if you have cancer in your family. I mean, everybody has those. That's important too. I don't even know if I answered that well. Sorry, guys.
I actually, I think Ann, you alluded to it, but I'll just, I will add, and Amy could probably confirm. So there are some federal and state funding sources that come through that allocate based on the density of need or even the density of population. So for example, we don't receive as much in homeless supports because there's a lack of density of homeless individuals. So in some cases that makes the work of like homeless service providers in this county even harder, because there's not like a flood of funds coming in, but you know, to build some infrastructure, you do need that flood of funds coming in. So it can be tricky for our service organizations and our work groups to receive those big buckets of funding that could make real dramatic work happen, because we unfortunately aren't in a city.
Absolutely correct, Liz. I would completely echo that.
Thanks, ladies.
I also have I read that the Livingston County Homeless Shelter recently closed. Are there efforts to start a new one? And what are the homeless supposed to do? And so I'm going to answer that, if that's all right, Liz and Ann. So the Severe Weather Network did recently close, and we are doing the same thing we did when the Severe Weather Network wasn't open. So they were usually only open December until March. And so the rest of the year in Livingston County, we provide hotel vouchers. And so the Homeless Continuum of Care has worked diligently to come up with solutions to help support during this time. And so right now the Salvation Army has a warming shelter Monday through Friday from 9 to 4. And on Wednesdays, they have thanks Liz, they have a support group Wednesdays at 1 for those who are suffering from in homelessness or near homelessness or need some resources. They can come out and have conversation. And they're also providing hotel vouchers right now, same as we do all year round. So we are always working on it and looking for solutions for that. Any other questions? No, I think that's all it was.
None other on my end. I am going to share an evaluation link. People can feel free to keep adding questions if they come up, but there's just you can open that form and fill out the evaluation.
I just wanted to say thank you so much for this presentation tonight. I really wasn't sure what to expect, and it was extremely informative, and especially the 1 out of 4 people, when you put that into a 25% of our county is struggling like that. It really hits home hard. Again, all of this information is going to be shared in a follow-up email, and along with all the links, material, hopefully even the PowerPoint, if that's possible, you can share that as a PDF. We'd appreciate that. It's always nice to have that in your hands to really look at it. I want to thank everyone for joining us tonight, and Amber especially. I just wanted to share, she's working overtime tonight to help us present this. So thank you, Amber.
Yeah, no problem.
We love our partnership with our libraries. The League is preparing for our next public forums in March and April. Again, we're going to partner with the Howell Library. Please follow us on Facebook. You can also go to our webpage and sign up for our email distribution list to see what we're up to. You can always share tonight's recordings as well. The more the merrier. And plus that information about February 4th at 242 Church, please share that with those who feel might benefit from that information. And again, hopefully we'll include that in the follow-up email as well. There's a lot going on in our county.
I think Liz is going to put the link to Community Connect right in that. So yes, if you can help share that, that's great. If I have one more second, I just want to mention that on a Friday night, we are also having a networking event to come out. So there's it's totally different event. This is agency to agency. So if you're, I think the League of Women Voters is coming out and working. Livingston Link Up will be at 242 on Friday from 4 to 6:30. You must RSVP to attend, but this is really, if you represent an agency, we're trying to reach like school social workers or doctor's offices, whoever is going to help provide referrals to community agencies. We're asking you to come out and meet our agencies that are going to participate in Community Connect. So you have the option to come out and network. And then on Saturday, it's for our clients or consumers or guests to come out and receive those services and giveaways. But Friday night is strictly kind of that agency professional networking opportunity, if that makes sense. So I think Liz is putting all those links in the chat. And please share if you have, know of somebody that refers and they want to come out and learn more about the services in our community. I think we're really excited. This is brand new this year. We know there's two parts to Community Connect, that agency to agency networking and collaboration, and then meeting our guests where they're at.
Perfect, thank you. And
Thanks,
I do realize that we have a few of our league members who are volunteering, not for the league, but on Saturday to help that whole support group, support presentation or day happen. So I'm really glad to hear that as well. Again, thank you. And Amber, do you have anything else to add?
I think the only thing is I just wanted to thank the League of Women Voters for continuing to work with the library and our presenters today for sharing that wonderful presentation. The follow-up email will probably be in about maybe in a few days. Once I get the recording up, I want to send all the links with the recording at the same time. And I'll include the evaluation link in the follow-up email as well, just in case you didn't get a chance to get it from the chat. And then you can visit our website, howelllibrary.org. So thank you all for joining us and have a good night.
Thank you.
Thank you.
Thank you.